Hello everyone, my name is Paul Drake and I'm a plastic surgeon working in Glasgow Royal Infirmary. This weekend our team has looked at how the use of open data and technology could be used to improve the health of people in Glasgow. The Glasgow effect refers to the significantly poorer health of the people of Glasgow compared to the rest of Scotland, as shown by the increased mortality rate and reduced life expectancy of the population. However, from the open data analysis, 75% of people who responded to a health questionnaire reported their health as being good or very good. This is in stark contrast to the published health figures and the data within the open data dataset. And this is in spite of numerous public health initiatives and information initiatives aimed at improving health. One reason for this discrepancy may be the volume of information that people have to digest and the way it is delivered. Health messages are often perceived as being contradictory, there are too many of them, and they're hard to understand. In addition, some public health information and public health programs appear to deliver information in an impersonal manner that is not relevant to the individual. We believe that better communication leads to better health. The Glasgow Centre for Population Health has provided evidence that there is a clear correlation between improved communication and building social relationships that has an impact on better health. However, the traditional consultation has been repeatedly demonstrated to be an inefficient method of information delivery. And we believe that strengthening this relationship and this interaction will lead to better health for the population. Have you ever left your doctor's surgery feeling that you didn't understand all the information you were given and maybe didn't feel that you could ask? Or have you ever left feeling that you wanted to ask a question that you'd forgotten in the heat of the moment? We have a comment from one of my colleagues, and this typifies the situation where poor communication leads to medical errors and is a source of patient complaints and dissatisfaction. So the solution we've looked at provides a personalised summary of your consultation with the doctor that can be seen almost as an information prescription, with the ability to provide feedback on the quality of the information provided. This is accessible through a web app in the web browser, smartphones, tablets, kiosks, notifications through email, SMS, and a standard telephone system for those who have poor access to technology. The system has been planned in accordance with the guidance given by the Information Commission and the Royal College of General Practitioners with respect to storage, access, and authentication. The data is in fact separate to the patient's medical record to reduce the risk to sensitive data. And the system uses readily available technologies that can be implemented in existing infrastructure. Patients can volunteer additional information on their health, which can be compared with the open data held for the local area and displayed on the doctor's dashboard. The dashboard gives feedback to the doctor on the quality of patient satisfaction from the information provided and can be tied in to relevant open data for that local area. We think this will lead to an improvement in the quality and retention of information and promote future engagement of patients with the health service. The feedback we've received indicates that not only could this benefit patients, but it may also benefit doctors as it provides metrics and evidence to be used in revalidation, which is a requirement every 5 years. The system can be expanded to deliver additional information and information on services that are available in the local area for patients. And we expect this to be useful in the public sector, private sector, in Glasgow, in Scotland, and as increased communication is of benefit to everybody, then further afield and internationally. Patient access to their medical records is something that's coming. However, the information in that record is often from many sources, it contains jargon and is difficult to understand. We think this system bridges the gap between full access to a medical record and provides a method of retaining information and increasing patient education. Thank you very much.
Thank you. Health e-records.
So a very interesting and worthwhile idea, but I can't quite see how the information is transferred from the consulting room to that nice lay summary that the patient can easily understand. Surely that's additional burden on the doctor that they won't be able to take on board.
We have considered this, and information is placed into the record at the time of consultation on a regular basis. This is a summary of that. So this information has already been thought about, and we imagine the data entry. And from my personal experience as a doctor, the additional time should be small. We also feel that that time may be well spent in reducing the number of repeat appointments given just to explain what was said at the last appointment, as that's a regular occurrence. Evidence has shown that delivering more information, personalised information to patients, doesn't increase, for instance, rates of litigation or rates of reattendance. In fact, it reduces reattendance with the practice, therefore leaving space for other appointments for people who maybe have poorer engagement with the service or require more face-to-face contact.
I'd like to ask you about that re-engagement process and a number of things you said around providing more information. And again, I suppose it's a little bit about, is that an additional burden for the NHS in doing that, or are you referring people to third-party sources of information?
Sorry, I didn't understand the...
So if I get my plain English summary of what was said there, and I read it, and on reading it, I realise I didn't ask the question I'd intended to, yeah. Am I supposed to re-engage with the doctor, with somebody else within the NHS service, or through a third-party source of information?
Your feedback on that information goes to the doctor that you saw, or the surgery that you were at. And we don't want this to turn into a long stream of question-response. So that has to be limited to one response from you and one response from the doctor. That response might be, you need to come and see me again. That response might be an answer to your question, and then the episode is closed.
I'm not quite sure on the outcome of this. You talk about communication, improving health, but I'm not sure the bigger picture, how that works.
Right. The premise is that patients don't often understand the information they're given, specifically in a brief consultation. So this provides the information that was discussed to them so they can then have time to digest that and then give feedback to the doctor on the way that was delivered and whether it was effective. This allows then the doctors to assess how they deliver information to their patients and opens the door for service redesign or provision of other services to their patients.
Does that link to improved health?
Well, the evidence that has been generated on improved communication between doctors and patients has been well documented in the scientific literature with metrics and percentages and statistics of how that improves health. Not only perceived health, but functional health in terms of improvement in reported outcomes of various disease states, hypertension and glucose control.
Okay, thank you, Health e-records.